Welcome to day 2 of Women's Health Week. Today, we are talking about something that isn't talked about enough, mental health. We're joined by Christiana Care psychiatrist, Dr. Zubani Maheshwari, and Dr. Josephine Mokonogo. Thank you both for joining us. Please take a minute to introduce yourselves.
Hi, I'm Zubani Maheshwari, and I'm a psychiatrist specializing in women's mental health and cancer-related behavioral conditions.
Hello, I'm Josephine Mokonogo. I'm also a psychiatrist. I specialize in women's mental health and also psychiatric conditions interpersonal with virtually any other medical illness, which is called consultation liaison psychiatry.
Thank you both so much for being here. And just a reminder to those who are watching us live here on Facebook, if you have any questions for either of our doctors here today, please leave those questions in the comments below and we will get to them throughout our conversation. So let's start right off the top. What do people need to understand about mental health and the importance of this conversation here today?
Mental health is part of its health. Our brains are part of our bodies. And I think that there's a lot of misconception that mental illnesses are things that are somewhat under our control or are hidden. But our brains are part of our bodies, and our brains get sick just as the rest of our other bodies do. Our brains sometimes can be vulnerable due to an interplay of genetics and environmental factors, just like people who struggle with hypertension, diabetes, or arthritis. And since our brains can get sick, it's something that sometimes requires medical treatment. And it's not something that we can wish away or overcome if we were only strong enough. Sometimes we need to get treated, and there's no shame in it because we're humans and different parts of our bodies get sick.
Absolutely. And Dr. Maheshwari, is there a difference between men and women when it comes to mental health disorders?
There are a few differences, and there is literature regarding how gender differences in mental health can, in some ways, impact a woman throughout her life. It could be during pregnancy, after puberty, or during menopause. And studies have shown that women may be more vulnerable to certain conditions like anxiety, depression, or fear and trauma-associated disorders. And in terms of gender differences in mental health, the reason is not solely because of any one primary factor, but often a combination of different factors. For example, a woman's biology, which means the role of hormones like estrogen and progesterone, and some other social and cultural factors, for example, the society's role, expectations from a woman, discrimination based on gender, or any history of trauma if they may have experienced. So as physicians or as individuals, as providers, it's good if we are mindful of our individual patients' needs. And specifically for women, it's good if we are aware of what certain barriers may be when we are treating them.
Absolutely. And, there are probably 2 times in a woman's life when she may be, struggling most with behavioral health, and when she has a baby and when she enters menopause. So Dr. Mokonogo, what is advice that you have for women who think they may be dealing with, postpartum depression or postpartum anxiety?
Talk to someone. Talk to your OB, your psychologist, your therapist, or even your family, your general practitioner. Postpartum depression and anxiety are quite common, and it is due to the interplay between hormonal factors in that period and genetics. It is no indication that you're a bad mom or a bad wife or a bad person. It is no indication of personal weakness or lack of strength. It is simply a symptom of something that is going on during that specific period, because there are significant hormonal shifts in the pregnancy and postpartum period that interact with our bodies, including our brains, and can cause these new changes. There is treatment for it, and no one is going to take your baby away.
And would you have similar advice to someone who may be struggling with the loss of a child?
Yes. The loss of a child is likely the most stressful event that can happen to a human. And it comes with a lot of feelings. And regardless of what happened, it is not uncommon for the mom to think, if only I tried harder, if only I had done this, to feel that this is their fault in some way. And that isn't true. These feelings are normal because this is an incredibly stressful situation losing a child, unbelievably stressful. But there is help, and you do not have to feel so bad. There are things that we can do. There is therapy, there are medications if necessary, and we can help deal with this in a different way. Help to, as they're going through it, we can provide resources and support.
And Dr. Maheshwari, what is your advice for a woman who is maybe noticing a behavioral change with menopause?
So with transitioning to menopause or the perimenopausal period can be a difficult time for a lot of women. It often brings a lot of anxiety, a lot of stress, and the anxiety or the stress can be partly attributed to the hormonal changes, which is reducing levels of estrogen and progesterone, which are the main female sex hormones, and partly because of the physical or the bodily changes. For example, during this time, they may be experiencing distressing hot flashes and sweating. And part of the reason why menopausal or the perimenopausal time comes with a lot of emotional changes is because it is accompanied by social factors, which means, some examples would be that during this time, women may be worried about getting older or age-related other health problems. This is a time when they may be worried about their significant others' health problems. And around the same time, a few other things are happening. For example, children are leaving the house, so they may be feeling more isolated, they may be missing their kids. And also around the same time, their own parents are getting older. So they are caring for their aging parents as well. So it is a combination of a lot of different things that makes menopausal or the perimenopausal time quite difficult. So for these women, I would advise recognize what they're going through, know the signs of depression. And we do know that during the perimenopausal time, the rate of depression could be higher than 2 to 14 times than what we see in the premenopausal period. So some common signs of depression are irritability, sad mood, losing interest in doing things that you may be enjoying earlier, difficulty concentration. You may notice some change in appetite or sleep, and some women may also endorse or have suicidal thoughts. So if it's a crisis, if you are having thoughts to harm yourself, get help immediately, and we will, write down those phone numbers in the chat box. But of course, speak with your doctor to rule out any other medical conditions. For example, thyroid conditions can also bring similar symptoms. And the treatment is usually starting with lifestyle changes. So for example, quitting smoking, exercising regularly, eating a well-balanced and a healthy diet, getting adequate sleep, and speak with your gynecologist regarding any physical symptoms that you may be experiencing, and speak with a psychiatrist regarding any mood swings or mood changes that you may be experiencing, because with collaboration, working with the gynecologist and a psychiatrist, you will get better. These symptoms will subside.
So much important information. Thank you. And no matter what the age or personal situation is of someone who may be watching, everyone's lives change over the last 2 years with the COVID-19 pandemic. Dr. Mokonoko, what advice do you have for women who may be feeling overly anxious, stressed, sad, name your emotion during this period of time dealing with COVID?
So this has been a difficult period for everyone. With what happened with COVID, I do not believe that any one of us envisioned how our lives would change, both our daily lives, the way we work, the way we interact with our loved ones, from the lockdown and the isolation to the children staying home from school for months on end, to people having to change the way they worked. There is the literature that has come out of that period has shown that women have taken the hardest hit regarding adjustments from work, dropping out of the workforce entirely, and having to manage childcare responsibilities during this period. So for women who are stressed, that is a fairly typical response to an incredibly stressful situation that they've had to go through no fault of their own. Once again, I believe that it's not, I would like them to know, it is not because that they didn't try hard enough, or that they weren't strong enough, or they weren't good enough at being partners, wives, mothers, women, workers, however they identify. They should check in with themselves. Make sure you're getting at your, what we call the nests: adequate nutrition, exercise, sleep, taking time to yourself, and using available supports. Sometimes that in and of itself, if those things are addressed, give a reset to the heightened emotions and the stressors. The next step would be talking to your family medicine provider, a therapist, a psychologist, or a psychiatrist. Sometimes talk therapy on its own is quite useful at processing these emotions and these feelings of anxiety and quite often guilt that women feel during this period. The isolation has not helped. So using whatever technology is available to interact with our loved ones. It's not the way we might have been used to interacting with them, but we live in a different world now, and it will take some adjustment, but we can still create meaningful relationships without necessarily being in the same room with someone. And as Dr. Maheshwari said, feeling all that, if you start to have thoughts about suicide, that is a time to act immediately, and we will provide the numbers in the chat.
Absolutely. If you're looking for any of those numbers, please check the comments below, and we will have multiple resources there for you to take advantage of. Now, Dr. Maheshwari, I love what Dr. Mokonoko just said about nests and making sure that you're taking care of all of that. You know, separate and apart from COVID, you know, sometimes just watching the news or, you know, dealing with negative feelings about other things that may personally be, you know, heavy for you is a struggle for someone. So, you know, how can, if someone sees that and someone's saying the news is triggering to me, social media is triggering to me, you know, what are tips you have to compartmentalize some of that?
Absolutely. And I think this is a great question. There is an information overload, you know, everywhere around us, especially in today's day and era, where there's a 24-hour, you know, news cycle available, social media always available at your fingertips. There's sometimes just too much information pouring in from all different directions. And, you know, even though, you know, it's good to stay updated about what's going on around us, often just, you know, being surrounded by a lot of information can bring a lot of emotions. And I would say that some level of worrying is normal, you know, after listening to a negative news, but it becomes problematic if the worries are consuming your entire day, or if the anxiety, you know, or the stress is making it difficult for you to fulfill whatever it is that you are supposed to be doing that day, or if it interferes with your daily activities. So my first tip to everyone would be first to limit news consumption. That can be done either by turning off phone notifications, laptop notifications, and being mindful of how much time are you spending on social media or news channels or other similar websites. And if you think you're spending too much time, you know, cutting it down as well. And if you are someone who feels that after watching, you know, heavy news or negative news, it makes it difficult for you to sleep at night, you know, try to avoid watching news or anything that is triggering before going to bedtime or even in the evening. So limiting all of that to early hours of the day. So hopefully with that, you know, you will feel more relaxed by the time it is for you to go to bed. And then Once you're home from work or school, spend quality time with your family members, talk to your loved ones, engage in meaningful activities which will help you relax. It could be something as simple as reading alone or reading to your kids or playing board games, pursuing a hobby, basically anything that may help distract your mind from the negative news and keep yourself, engaged in a good way, in a more positive way.
Super helpful. Thank you. And I think some people potentially are now sitting here like, you're right, maybe I should do that. So thank you so much for that. Now, Dr. Mokonoko, if someone's watching and says, I don't personally feel that way, but my partner does, my sibling does, my parent does, how can they help that person?
That is a good question that quite a few people struggle with. Thank you. If someone has a loved one or knows someone who is struggling, approach them in, I would say, a non-judgmental way and ask them, how are you doing? Is there anything I could help with? If you notice that they have changes in their behavior, in their thoughts, depending on the relationship, you could bring that up. I notice you're not sleeping as much. I notice that you're not eating as much. I notice that you seem to be crying often. Is there anything I can do? I watched a Facebook Live recently, and they from what you say, they think you might be struggling with depression or anxiety. And they suggested talking to your primary care provider or your OB. If you feel that that person is in danger of hurting themselves or others, you may need to call 911 at that point to help them maintain their safety. If they're not in danger, something as simple as helping them make appointments, providing support in the form of food or helping them run errands or helping them care for other things so that they may be able to take care of their nests or take time to themselves or take a nap. Providing resources, the phone numbers that we put in the chat, I believe, in case that, so that they may be able to use them. I would caution that using phrases like, well, I don't understand why you're feeling this way because you have good health, you have all these things going on, are typically not as helpful as we think they are, because they know they have these things, and quite often these feelings aren't due to ingratitude, they're due to an interplay between their specific genetics and things that are going on in our lives, in their lives. And it is a stressful period right now. And these feelings aren't entirely or aren't at all within our control. So ask them, check in, help when you can, provide resources.
Thank you so much. That's such helpful information to so many people. And Dr. Maheshwari, before I let you go, what is the most important takeaway you want people to understand from today's conversation?
Well, I would say, number one, prioritize your mental health, your emotional well-being. And number two, do not hesitate to ask for help. If you don't ask, others may not know that you are, going through certain challenges or having a difficult time. And as women, we often tend to do a lot of things. We often, multitask. We are managing our houses, we're managing our jobs, we're taking care of our significant others, parents, and children, on top of paying bills and grocery shopping and whatnot. The list is endless. So, be easy on yourself. It is okay to take a little break and big breaths. You may have, heard it elsewhere. Inhale like you are smelling flowers and exhale like you're blowing out candles. This has helped me a lot. So I hope that this will help, others equally. And sometime back, I read an interview by an author named Nora Roberts, and what she said was quite helpful for me, or for women in general. And she said that, as women, we're often juggling, multiple different things. So assign as task like a ball, like It could be either a glass ball or a plastic ball, and you're juggling all these balls. And of course, you don't want the glass balls to drop and shatter. So the glass balls will be things that you absolutely must do. So the high priority things on your list. For example, going to your appointments, getting the kids to school, paying your bills on time. You certainly don't want to miss that. And plastic balls will be some task which, okay, if you drop, it's okay, no harm done. You can pick it up later and maybe do it at a later time. Those will be things like doing laundry, for example. It's okay if this weekend you didn't do it, maybe you do it in a couple of days, or, buying bread, or tomatoes from the grocery store, or buying a bottle of, Play-Doh or slime for the 30th time for your child. It's okay, those things can be done later. So prioritize, your mental health as well, and take care of yourself is, what I would like to end with.
Amazing. So many important things. I love that analogy of separating your life a little bit into what needs to be done and what is okay if you have to come back to it. Thank you so much for that. Dr. Mokunogo, last words from you. Tell people how they can get in contact with our wonderful providers here at Christiana Care.
So Christiana Care, you can call the General Outpatient Behavioral Health Service at the phone number, and I believe that that's going to be in the comments there. Our phone number is 302-320-2100. Or for those who prefer to email, you can email us at christianacare.org/services/behavioral health. That is also in the comments. For those who would like women's mental health, we have a different number, and that is 302-733-6662. And that is the number for those who are trying to conceive, currently pregnant, or within 1 year of their postpartum state. For more urgent issues, the Newcastle County Mobile Crisis Intervention is open 24 hours a day and 7 days a week. And their phone number is in the chat. We also, for those experiencing suicidal thoughts, there is a suicide hotline available. 1-800-273-TALK, 1-800-273-8255, or 988. If you're experiencing those urgent symptoms, don't wait.
Thank you so much. Dr. Maheshwari, I think we should end on the breathing technique that you shared. So please lead us in that and we'll say goodbye.
Very well. So let's, if it helps, we can close our eyes if you would like to. So closing our eyes and take a deep breath like you are sitting in a garden and smelling some beautiful roses or tulips, pick your flowers. And exhale like you're blowing out your birthday candles.
I did a much shorter exhale than you guys, so I obviously have much to learn in this department. But thank you both so much for being here and sharing this incredible information. I hope you at home found this incredibly beneficial, and join us tomorrow for day 3 of Women's Health Week. We are discussing perimenopause and menopause with Dr. Rachel Heinley. Thank you all so much and have a great afternoon.
Thank you.
Thank you.